Welcome to the Spinal Truth Show weekly Q&A edition. I am Dr. Caleb Slater, here to answer your questions. With me, I have Chris, our producer, filmographer, videographer, and so many more things in between. And I have my wife, Danielle Slater, a pelvic floor women's health expert physical therapist as well. So we are here to answer your questions. We are here because we have a unique view of the medical system, a unique view of treatment that has worked so much better than anything I have come across in my 16 years experience. If you have questions, if you've been suffering with something, some conditions, some symptoms, if you're not getting the answers that make sense to you and you're not getting the treatment that's working, we are here to answer. You can leave a comment below. You can reach out to us on TikTok, Instagram, or Facebook. You can also reach out via thespinaltruth.com, and if you'd like an appointment, if you'd like to see a better way to view and treat your symptoms, thespinaltruth.com. So what do we have up first for our first question, Danielle?
Yeah, we have a great one to start today. This is from Naomi Zahler. Her comment was regarding one of your Crohn's posts. And she said, "This is silly. There is literal genetic testing that shows when you genetically have Crohn's disease. It's an autoimmune disorder, so it stems from the immune system."
So this is great to talk about, and this comes with the first chapter in my book is actually a book is about Crohn's, and it's because I found that treating patients with Crohn's and treating the areas of their spine that innervate the intestines and the stomach actually has cured them of their symptoms, and it's been the case for multiple patients now, and it got to the point where I had to speak out about it because she's right. Crohn's is only looked at under one lens of an inflammatory autoimmune condition, and there really isn't another explanation for it, even though we don't know what causes it, what triggers it. And she is right that there are markers, genetic markers for it, but she is wrong in the sense that those markers don't diagnose you with Crohn's. So there are a lot of people out there that have these genetic markers and have no symptoms, no Crohn's whatsoever, and then there are people out there that don't have these markers and have Crohn's. These markers just show a predisposition, maybe a likelihood of having symptoms, of having Crohn's, or of actually getting cancer from the condition of Crohn's. But in order to make the diagnosis, you would still have biopsies, endoscopies, blood work, and other testing, as well as ultimately your symptoms to make this diagnosis. But here's kind of the important part, is that all these same symptoms of the inflammation, of poor motility, of diarrhea, or of colon spasming, or all the symptoms that can present with Crohn's can be caused by a nerve issue at the spine, a nerve signal not getting to the intestines, not getting to the stomach. It can cause nausea, pain, cramping. It can cause constipation, diarrhea. It can eventually lead to inflammation. It can lead to ulcers. It can lead to fibrosis because that nerve signal is not getting there. Now the muscles, the intestines, which are muscles, aren't contracting properly, aren't moving waste, aren't pumping blood through the area. They aren't healing. They're basically dying. And restoring that signal can solve the problem. So what the information I'm trying to get out there is that if you are getting these diagnoses, if you are getting these symptoms, there's another solution other than lifelong medication, such as biologics and prednisone, that just numb you to your symptoms. There's another explanation that if it is the case, not only did you not have this lifelong chronic disease and you don't need this lifelong medication that just manages your symptoms, but there's actually a cure. And if you want to see some proof, you can read my book where I have a real life patient example in it and I provide all the research, all the citations for it. But you can also go to my TikTok or Instagram page where there are other patients talking about how their symptoms weren't being treated under the current medical system and they sought me out and the improvements that they had.
I find humans very interesting insofar as they will be willing to go to these extreme lengths and defend something while still suffering from something. But you say, I'll give you a few exercises to do with your back for a few weeks. And the pushback on that is intense.
Oh, yeah.
But they're willing to take steroids, which have all kinds of side effects, have major surgeries, all these kinds of things, and still go back and push back against you, even though they've never probably been to medical
Well,
school.
and like what you said, they're still suffering, right? And so you know what? If you're out there, if you have Crohn's or ulcerative colitis, and the biologics that you're on completely solve your symptoms, you are asymptomatic because of the biologics, reach out, tell me I'm wrong. But if you still can't eat the foods you want, if you still feel unwell, nauseous, full, bloated, if you still have diarrhea, if you still have flares, despite the fact that you're on the medication, let's hear that as well.
But to me, the reaction is confusing because I would think the reaction of, hey, I need you to take these pills that will have major side effects, or hey, I need you to have this major surgery. That's where you should be kind of pushing back. But instead, the pushback comes in, this PT says if I do these exercises, it'll make me feel better.
Right.
But I can't do that. Instead, I'd rather argue against that instead of just trying. Because what's the side effect of you doing back exercises?
You know,
You know what I mean?
there's very little.
Exactly.
Comparative to taking the medication, right? And again, I'm saying give me a reasonable time frame. Give me 5 weeks. Give me 5 weeks of showing you how to take pressure off these nerves and see what happens to your symptoms. And if you're getting reasonably better, let's continue, right? I've had patients that within 5 weeks, they're 80 to 90% better, and they're now getting off of their medication because they realized it wasn't helping, right? Or give me 5 weeks, it didn't help, and now you have the same solutions available to you, and there you go. And hopefully your back's a little bit more flexible, a little stronger as a result anyway. Yeah, it's a shame. I think so many conditions and symptoms out there are misdiagnosed and mistreated in the current medical system. And, you know, an elbow pain being misdiagnosed is kind of one thing, right? But Crohn's or ulcerative colitis, now it's a lifelong condition that has, you know, pretty heavy treatments applied to it. That being misdiagnosed, that's in a different ballgame.
I know many people who are diagnosed with Crohn's or fibromyalgia, and now that is a major part of their identity, and it impacts their life in major ways, even as someone who's interacting with them. Mm-hmm. Hey, let's go do this. My fibromyalgia is bothering me today. Like, I can't, I don't have much energy. Like, these are things that people just accept as part of their life now, and are unwilling sometimes to even try a solution you're offering, or at least...
Which I understand too. I understand somebody saying something that's completely different than everything that you've heard, right? There's an expense to it, right? There's time and energy that to it, and sometimes too you just don't want to get your hopes up. But how many things have we gotten wrong in the medical system over the years? How many medications have been ripped off the shelf? How many diagnoses have we changed, or have we realized that we were treating wrong, even within the physical therapy realm? I like seeing those videos out there that's, you know, the progression of physical therapy over the years, where like we were doing ultrasound to everybody and then we were like, no, ultrasound's crap, it doesn't work. And then we were doing kinesiotaping to everybody and then we're like, no, that's crap, it doesn't work, and so on and so forth. We get a lot of symptoms wrong, a lot of conditions wrong. And it wasn't until I really started thinking, you know what, if I know a lot of the knee pain diagnosis is wrong, a lot of the hip pain diagnosis is wrong, what else is wrong? And I basically started, you know, really looking at the current medical system and how we treat that's largely entwined with medications and injections, right, and surgery, how we actually treat these symptoms and the results that we're getting. And I said, no, this just doesn't seem right. So until I started advocating for myself and different treatment for my patients, it wasn't until then until I really started making an effect across so many conditions, so many symptoms, and that's actually what led me to the Crohn's. The first Crohn's patient came in. I said I didn't know if I could treat, but I'd look and I'd see if there was an explanation that, you know, from the spine that could be. And within 5 weeks, she's 80 to 90% better. She stopped taking her Humira, and she's been symptom-free since.
Do you think it's because there's a lot of diagnoses that are like monoliths to people, and the solution you're offering seems too simple?
Yeah, and you know, we've talked. We made this a little bit more complicated. You know, we started looking into your microbiome and your DNA makeup and stuff like that, rather than just saying like, hey, there might be something wrong with your back. And a lot of these patients too, they've had back pain in their past. So who is a patient that might have been diagnosed with Crohn's, but it was because of a problem at their spine? Some of the more common ones are the people that were involved in gymnastics, dance, running, sprinting, volleyball, football linemen, people, anybody that gets their back extended a whole bunch will put a lot of pressure on those nerves. And we're seeing this in younger and younger population today too. There are people that have had back pain and that back pain progressed. Maybe they had some leg pain at first too. We've seen a lot of patients that have hip, thigh, knee, even foot pain that gets misdiagnosed as like plantar fasciitis at first. And then as these symptoms progressed, now they started getting stomach, abdominal pain, diarrhea, constipation, stuff like that. So yeah, I think you're right. Like you were saying that if the diagnosis is so complicated, you can't really refute it, right? You can't really argue with it because it's outside your specialty. But if I say, hey, it's your back, you're like, well, that makes it's easier to debate.
Right. No, yeah, I agree.
That was great. And just to substantiate what you were talking about, it does says there's genetic testing to identify whether a patient carries a mutation that could cause Crohn's disease. However, it does not mean that they will even develop Crohn's. And when talking about Crohn's disease being complex in terms of causes, it says the condition results from a combination of genetic, environmental, lifestyle factors, many of which are unknown.
Yeah, and so many of these conditions, fibromyalgia is maybe the biggest, right? They have an unknown etiology, an unknown reason why, an idiopathic reason, which in the medical field literally means I don't know why. And why don't we know? With all the technology we have, why don't we know? It's probably because we're viewing these conditions wrong, with a wrong lens, and with just a little bit of a different tilt. I've been able to make so much more progression for my patients and their symptoms by treating the spine and looking for an underlying cause at their spine. And that's all the information I'm trying to get out here is, hey, if you're still suffering, if you think you might be misdiagnosed, if you are debating getting surgery or going on lifelong medication and you want to see if there's a better option out there, then I'm here for you.
Yeah, and I feel like you're really trying to target that lifestyle of their spine, their activities, their posture.
Yeah, and for me, it makes more sense. Why are your symptoms sometimes there, sometimes not? You know, why, if you have an underlying autoimmune condition, you know, why is sometimes you're in remission and you have no symptoms, and other times you're extremely symptomatic? Well, a disc issue pushing on the nerve and moving on and off the nerve actually explains that better than your autoimmune disease
Flaring up.
Yeah, going away for a little while.
Yeah.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
All right, our next question is, who do you go to see? A chiropractor or a physical therapist?
So I get this question a lot. I am a physical therapist by trade, and been so for 16 years. That being said, unfortunately, I'm not overly fond of my profession's way of treating. There are great physical therapists out there, and there are bad chiropractors. There are great chiropractors out there and bad physical therapists. In general, I see physical therapists doing the typical straight leg raises, prone quad stretch, clamshells, stretching your neck, stretching your shoulder. I see those treatments more than I see treatments that I agree with. I think chiropractors do a great job at looking at the spine and mobilizing the spine, but then in general, where they would fall short at is that makes you feel better, but they don't do something to keep you better. And your body basically needs two things. It needs mobility and stability. So they helped create mobility, but if they didn't show you how to maintain it or improve on it, you lose it. They didn't tell you how to create stability, strength, and control in that range. So you lose it, and that's why you go to the chiropractor, you feel good, but then a week later, you're like, I need to go back. The whole goal is to get you to the point where you don't need to go back. You don't need to continue. You are now better, and I think our healthcare system as a whole falls short.
I've been to several chiropractors throughout my life, and every chiropractic session ends with you going to the receptionist and them automatically scheduling you for the next week or two. It's never a discussion about when this treatment will end. It's always just, all right, I'll see you in a week, or I'll see you in a week or two. So it's like, to me, it was always, I kind of always compared it to just like a massage or something temporary relief and never a solution to a problem.
So we call it palliative, right? Like, it makes you feel good. So there's nothing wrong with a massage. A massage, they feel good after you've worked out or you run a marathon, and or if you have certain like conditions, massage will help improve blood flow and remodel tissue, and even for stress relief, right? So massage has benefits. Chiropractic has benefits. But if you don't do something to maintain, you will just lose it, and it's palliative. It's just feel good in the moment, but then a few days, a week, 2 weeks later, you're right back to where you were, and now you need to keep doing it over and over and over again. And so you're kind of throwing your money and your time at not a solution, just a stay, just feeling better. And again, nothing wrong with that. But if it's me, I want to do something that has lasting effects.
Do you think it comes down to, again, we kind of push back on the patient, I think, in a way, where if you offer solutions and you offer exercises that the patient has to do then on their own time, their own free time, it makes it more difficult than saying, well, every Tuesday I go to the chiropractor for an hour and they do their thing and then I'm good for a few days.
Sure. Yeah, and it is a lot easier, right? It's a lot easier to say, I'm going to go to the chiropractor. They're going to do a little bit of heat, a little bit of ultrasound, a little bit of e-stim. They're going to crack my back, my neck, whatever, and then I'm out and I feel good leaving. It was relaxing while I was there, versus I'm going to go to some guy. He's going to put the onus back on me and say, if you move your spine this way, if you strengthen your spine in this range, eventually within a few weeks, you'll be better.
Yeah, and I think like the term therapy is what's important for me, because I go to a therapist to talk about mental, whatever struggles I'm having. But if I just go to the therapist and we talk for an hour, I feel a little better just because I talked. But if they give me, things to do to improve my, whatever I'm struggling with, if I do those things, I see the results. And so the onus is on me to take some responsibility as well in my treatment, right?
Yeah, and exactly. And again, you kind of get out of it what you put into it. And not saying there's anything wrong with feeling good in the moment, with taking a pill, with going to a chiropractor, with getting a massage, with doing a stretch that, makes you feel good in the moment. But at the end of the day, I want to put my efforts into something that's lasting, and it's simpler than we've made it. You need mobility, and then you need stability and strength in that range. If you get those two, you are now better. You are now different. And so that's the solution. So to answer this person's question, it would kind of depend on what symptoms you're having. In general, for physical therapy, I like people that are have a specialty in McKenzie physical therapy. It's one of the specialties that my wife and I both have. And I think they do a great job for a lot of neck pain, spine pain, carpal tunnel symptoms, stuff like that. I think they fall short in some other areas. I think chiropractors will do a better job for more of your like chronic conditions that are related to the spine, like your nausea, acid reflux, maybe even like your bowel symptoms. There's pelvic floor specialists out there for bowel and bladder, but a lot of them just do kind of bladder training and internal techniques that I don't necessarily agree with, and I see a better way. So it really depends on your symptoms, and it depends on the experience of the person that you're going to and the view that they have.
Yeah, I agree. I think a lot of practitioners in every field are just symptomatically treating and trained. But when you can take a step back and appreciate a causative.
Well, and this is good for you. You are a pelvic floor specialist, a women's health pelvic floor specialist in your field with years of experience. You've done all of the down training, bladder health education. You've done the internals. You've done all of the stretching and the breathing exercises and stuff like that. And you found it leaving you and your patients wanting, meaning...
Yeah, I found that they kept needing to come back at intervals.
Right.
And it just felt like it was just management of symptoms and leaving me feeling unsuccessful in wholly getting them better, no matter how many pelvic floor courses and books and podcasts I listened to. Still didn't
Which was
seem,
a lot.
Yeah. We were at courses like every other weekend, just excited to learn and try out new things, and just wasn't fulfilling for getting the patient better.
And now that you're treating these people by first looking to their spine, how have your treatments been?
Yeah, so much more successful.
And so what are some of the symptoms, conditions that you're treating this way?
Yeah, things from bladder pain and frequency to pain in the genitalia region, pain rectally, a lot of success with treating GI issues that are contributing to dysfunction like constipation and incontinence. So just everything.
So I guess
Ultimately,
the
everything.
short answer is go to somebody that's going to at least look at and attempt to treat your spine.
And at least start there.
Yeah.
You know what? And then if there's still a few things to wrap up, but ultimately, just treating the symptoms is not going to often cure
No,
what
but
you have going on, and not for the long term.
no, but it'll make you feel better, and that's almost kind of can be a negative in the sense that it made you feel better, so it gave you false expectations, false hope.
It's weird that we do have such tunnel vision. And like going back to like mental health, we know physical exercise and movement helps your mental health like dramatically. And so our whole body interacts in some way. But when we say we have pain in our knee or pain in our groin or something, that's the only part that we're ever going to look at.
Yeah, no, that's a really good corollary analogy, right? Yeah. If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
All right, just a positive from a patient that shows other practitioners have seen some of the things that you have, saying, I was at my chiropractor today, this is from 2CW, and showed him your video about plantar fasciitis. He said you're 100% correct.
Well, thank you. Thank you for reaching out. I really do like the positives. I get a lot of them, get a good amount of the other as well. But it's always nice when you get a little bit of validation from it. It's nice when you see other healthcare practitioners looking at the body and treating the body the same way. It's the way I think it should be, and it should be more normal rather than the exception. So, but thank you for the comment.
Yeah. Our next one comes from AJ Belts. Her comment is, I have a question about that hump in the back of my neck. My mother has it, I have it, and now my 25-year-old daughter has it. I started noticing my daughter's shortly after she had her first baby.
Okay. So the hump is called a dowager's hump. It can have a genetic component to it, meaning like just like scoliosis can have a genetic component, and it's basically an increase in your upper back flexion, kyphosis, so bending, and then your neck extension, and that creates that pivot point, that hump. She said she noticed it after her daughter had her child, which is a really good tidbit to put in there, because a lot of women, after having their first child, second child, or after having children, you'll see their posture significantly change in this area, because what happens for a year to 3 years after they have that baby. For the first 6 months to a year, they are breastfeeding 6 to 12 times a day. And then they're also carrying that child like this. So they are in this position more than they ever have been. And we're in that position more as a society than we ever had been with our computers and our phones and our tablets. But when you have a child, especially a newborn, it is just constant. So you get a lot of women that say that their carpal tunnel symptoms started after they had their child, that their shoulder pain, their shoulder bursitis, their frozen shoulder, their elbow pain, a lot of this stuff started after they had their first child, and it's because of the position that you were in, like day in and day out for hours. And the answer is what to do about it is to do the opposite. We've talked a little bit in this show that medicine's simpler than we've made it. If doing this a whole bunch caused those symptoms, caused that hump, doing the opposite. And if you go to the carpal tunnel playlist on the TikTok page, you can see some exercises at the end that address this a little bit at the neck, but you also want to address this at the thoracic spine. Doing some extensions over a foam roller is great. The 3 exercises I just mentioned, they improve your mobility, but again, you need to do something to strengthen in that range. And this is what I do for patients when they come in for these symptoms, is I show them how to move their spine out of the range that it's been stuck in, that they've been moving it in and holding it in for the past months, years, but then I show them how to strengthen in that range, which actually keeps it there.
So I have a question. How long does it take if somebody starts a new activity that maybe puts pressure on some part of their back before symptoms usually start to reveal themselves?
That's a good question. You have to go on what symptoms are, right? Because so if I poke you and it hurts, right, you'll pull away. You'll pull away because there was some pain, maybe some pressure. If I poke you and it hurts and you can't pull away, that pain and pressure now changes. It gets to a bigger area. It starts to deform the tissue. A deformed nerve turns into tingling, numbness, and weakness. So it's kind of, it could be immediate. You could get immediate pain. It could take months, years of irritation to start causing the symptoms that you're noticing. Initially, you might just chalk it up as is just neck pain. A lot of people chalk it up to stress or anxiety, and they don't realize that it's actually a problem pushing on the nerve, a problem at the spine, right? And then it's not until those symptoms worsen or they start to travel. Now, it was in the base of your neck. Now it's in your shoulder a little bit. Now it's in your elbow and your hand. Now you're noticing it more because it's affecting you more, because the symptoms are more global. They're maybe more affecting in the sense that numbness and weakness can cause more issues than just pain can. And again, I'd rather be numb and weak than in pain. Right. But physiologically speaking, pain is better. Pain is your initial response.
So just using me as an example, if I run, let's assume I ran at some point, but I get some knee pain sometimes, and I always assume, well, it's because I'm big and whatever, and I just push through it. I think it's pretty common that people will have some, maybe, it's not extreme, but it's there, and they'll just keep going as if that's just part of life. So what should I do if I start having slight pain like that that's uncomfortable, but not necessarily, crippling in any way?
Address it right away so it doesn't become crippling, right? Address it right away. And so this is a great example. When you run, your lower back extends. This puts a lot of pressure on the nerve. So a lot of people will get pain, numbness, tingling, weakness running down their legs, specifically from their knee down when they run. Mm-hmm. This is the L3, L4, L5, S1 segments of your low back. So your low back. Right? This area takes up a lot of force when you run and extends a whole bunch. So what we do is that we map out your symptoms. Maybe how long does it take when you're running until your symptoms come on? How intensely do they come on? Are they always there? Are they both sides? Then we look at, your knee. Can you bend it without pain? Can you squat without pain? Can you lunge without pain, right? But then we look at your back. And then we do some stuff at your back. And again, it's simple. If your back is extending a whole bunch and that could be causing your symptoms, show you how to flex your back a whole bunch to take pressure off that area, and we expect change right then and there. We expect change, less pain, more strength, more range of motion, less difficulty, tension, pain, bending, squatting, stuff like that. So the answer is don't put it off. Because when you put it off, what's going to happen is that your knee pain, it's not going to be there anymore. You're going to get used to it. It's your new normal, right? And now all of a sudden you're going to start having foot pain. Because that's what happens with nerve pain, is it kind of travels. The worse it gets, the further down it goes, okay? So now you're going to go to, who are you going to go to for your foot pain?
Podiatrist.
You're going to go to the podiatrist, right? But it was actually knee pain, which was actually spine pain. So the more you put it off, the more it morphs, and the harder it is for the medical profession to diagnose, because like what you said, we are very tunnel visioned, right? If you have knee pain, you're going to go to your primary or the orthopedist, and they're going to look at your knee, not your back. And it was your back pain. You used to have back pain, and it just became your new normal. You forgot about it. Your body got used to it. And now you're running, and it's your knee, and you're thinking, oh, it's my knee. It's the weight I'm putting on it. It's what I'm doing. You're going to push through that. It's going to morph into something else, and it's going to get harder and harder to say what the actual cause was. And you're going to get treatment to your knee that didn't work, and then you're going to get treatment to your foot that didn't work. And it's because it was a spine issue.
So what I'm going to take away from that is that I should not run.
You should.
No, that's a perfect, that makes a lot of sense.
And you really just talked about, you hit on what a lot of people go through, right? You'll push through a certain amount. If you're at like a 2 out of 10 pain in your neck, are you going to tell anybody?
No.
No. Are you going to go to the doctor for it?
No.
No. Are you going to get any treatment for it? No. But if you're at a 7 out of 10 pain in your elbow, are you going to?
Yeah.
You're going to do something about it, right? But that 7 out of 10 pain was because that 2 out of 10 pain in your neck worsened. And this is just what we do. And I write this in the book, is what do you do when you first have pain? You ignore it. You hope it goes away, right? And it doesn't get, until it gets to the point where it's really messing up your life. Now do you go to the hassle of scheduling an appointment, getting somebody to watch your kids, missing work, paying your copay, trying the treatment, getting the x-ray, right? You're like, oh man, that's such a trudge of processes you have to go to just to hopefully address your symptoms.
Before it gets bad, find a solution.
Before it gets bad, get somebody to figure it out, because as it gets worse, it changes. And I don't think people realize that. It changes in location, it changes in symptoms. And now all of a sudden, your back pain that was there is now causing your brain fog, your headaches, your nausea, your arm pain, and now all of a sudden, guess what you have? Fibromyalgia.
Yep.
Yeah, and it's true though, and it not only extends everything. It extends the cost of treatment, because now I have to be treated for several things, because like you're saying, we start and we move back at the spine. It all moves. Like I can spend 7 sessions with you because we have to work through a couple things, or I could spend 1 session with you and gotten some exercises and probably fixed my problem.
Fix it pretty much right away. You don't have an issue. It doesn't progress.
Right.
Yeah, absolutely.
Yeah, the sooner you can get treatment for something, I feel like the quicker it is to resolve. And we get that question all the time on our email about your approach. Just wondering like how long we expect it to take, and some of that can go back to how long has the symptoms been going on for?
How many symptoms do you have? How
Are
long
you
has it
having
been?
numbness, or are you having intermittent pain? Are you having constant pain? Like, you put this off for 20 years, it's not overnight going to reverse, but our goal is to try to change it.
Yeah, you should
quick
see
as we
steady
can.
improvements, but you're right. If it's been 20 years, it's going to take a little bit. But again,
And
still
some work, yeah.
still regardless, it's going to take work, and it might even take a little bit more pain on your part. But regardless, we still expect 50% or more improvement within a reasonable time frame.
Yeah. Well, that's a wrap for today. Thanks for answering all those questions.
All right, that finishes up our 3rd Spinal Truth Show weekly Q&A edition. If we talked about some points today and we didn't cover exactly what you want to hear a little bit more information, or if there was a topic that you didn't hear and you want us to talk about on the next show, leave a comment, reach out to us on YouTube, TikTok, or Instagram. If you want an appointment, if you've been tired of dealing with the medical profession and you're not getting the results that you want, the results that you deserve, you can go to thespinaltruth.com and schedule an appointment today.